Okay, now for the next drug which we're looking at is pharmacology is what? Letrozole. Alright, so letrozole is mostly sold under the brand name known as what? Femara. Okay, letrozole, Femara. Okay, so this letrozole, we look at is what? Overview the mechanism of action, pharmacokinetics, clinical uses, and side effects. Okay, so that this letrozole is most of the times marketed under the brand name Femara. That's a popular one. We're not saying that's the only one. Okay, it is actually what? A non-steroidal aromatase inhibitor. So it is inhibiting the aromatase enzyme. So this enzyme aromatase will usually convert androgen into estrogen, thereby increasing the levels of estrogen in the body. Okay, and some cancers are usually favored if there's an increment in the levels of estrogen in the body. So if you are now bringing something that will stop the aromatase enzyme, it will basically reduce that estrogen source that is supposed to come from androgen again. So it is primarily used in the treatment of what? Hormone receptor positive breast cancer in postmenopausal women. For mechanism of action, this letrozole works by what? Inhibiting the enzyme called aromatase. And this enzyme called aromatase is responsible for converting androgens such as testosterone into estrogen such as estradiol. So if you inhibit that enzyme, it will reduce estrogen levels. Okay, so it will now slow the growth of cancer cells that are actually dependent on estrogen levels to continue growing. You understand? So for pharmacokinetics, it is well absorbed orally with an absolute bioavailability of approximately 99.9%. It is extensively metabolized in the liver by cytochrome P450 enzymes, primarily the CYP3A4 type. Elimination, the drug is excreted primarily in feces, about 60% of it, and to a lesser extent in urine, about just 4%. The elimination half-life is approximately 2 days. For food interaction, food slightly decreases the rate of absorption of this drug, but the extent of absorption remains, but the extent, okay, the rate, but the extent remains unchanged, all right? Clinical uses can be used for adjuvant therapy. So letrozole is used for adjuvant therapy for hormonal receptor positive early breast cancer in postmenopausal women. Also, it is a first line of treatment. So it's used as a first line of treatment for hormone or receptor positive or hormone receptor unknown locally advanced or metastatic breast cancer in postmenopausal women. Then extended adjuvant therapy. Letrozole can be used in postmenopausal women with early breast cancer who have previously been treated for tamoxifen, okay, but probably they have not been responding to therapy. So side effects, if you are taking this drug, you can be expecting things like what? Hot flashes, nausea, vomiting, fatigue. Serious side effects is it can actually make your bones soft. So you have the risk of what? Having bone fractures, okay? Reduce the density of your bone so you develop osteoporosis. And there could be increased risk of what? Cardiovascular events too. So that's it for what the pharmacology of letrozole sold under the brand name Femara.